in my country, 16% of the population commands 60% of the specialist doctors. And this disparity is a direct form of structural violence where access to dignity and life itself is determined by wealth, race, and history, and not your health needs. My purpose, therefore, when I wake up every day, is to dismantle the residual architecture of this health apartheid and to affirm health as a fundamental human right and not a market commodity.
Hi, welcome to Equals, the podcast about inequality. I'm Grazi.
Welcome to Equals. This is Naf.
How is it going, Naf? How was COP30?
I have to say, Grazi, mixed feelings, about the outcome. But after each COP, I get into this gloomy state. I'm always asking myself how much COP delivers to the poorest, and we're talking about the majority of people around the world, who are impacted by the climate crisis.
Well, here in Brazil, it was covered as a success history with a lot of enthusiasm.
I'm sure, Grazi. And I also believe, the Brazilian COP presidency did its best managing, various critical issues in terms of negotiation status, from fossil fuel phase out to emissions reduction to finance to trade. And also was a tough job given that, multilateralism or the spirit of working together as countries is under attack. But I have to say my disappointment about this COP, or to be honest, about most COPs, is around finance and the lack of accountability. Because when it comes to the climate crisis, I truly believe there's a solution and we can address it. But at the heart of it lies, finance and political will. And at this COP and previous COPs, rich countries, keep on dodging their responsibility to provide finance for climate action. And also what I find concerning this whole year is, this push for private finance. And of course, this is one of their ways to dodge their responsibilities.
Yeah, it's really impactful to see the whole space that they have. Like, they had big spaces to lobby their ideas, while civil society and social movements, even the indigenous movement, were having to protest to have their voices heard inside. So it's kind of insane to see the power and the influence that the private sector and the private finance has inside of the COPs. And I can imagine how frustrating that is, because the climate crisis is only accelerating and tens of millions of people around the world are affected every year. So yeah, it must be hard.
Very. And exactly as you said, Grazi, meaning on one hand, the climate crisis is accelerating. We're witnessing all this flooding, droughts, wildfires, in different countries year after year. And on the other hand, the pace for climate action is slowing down. And now, it also feels like there's this huge push to turn climate action into some privatization agenda, which I find really concerning.
Yes, and that's what we're seeing across the world. Like in the entire developed finance, that's what we're seeing, this privatization agenda. And actually, this links to what we want to discuss today in this episode, which is the financialization and privatization of health systems and the human cost of it.
Yes, a really important topic, I have to say, that, affects everyone, and that I also believe everyone should care about and fight for.
Yes, and we have two incredible guests to talk to us about the fight against big corporate interests that have our national and global health system controlled. We have with us Dr. Aquina Thulare, who is a prominent South African medical doctor and a public policy expert who holds a key position in the National Department of Health, specifically as a technical specialist for the National Health Insurance. She has also been running the G20 program on health while South Africa has the presidency.
And we also have Anna Marriott, who has led Oxfam's work on universal health coverage and public services for close to 2 decades. She has also published several papers on health financing and healthcare delivery.
Amazing guest. I'm looking forward to the interview, and I really expect that this will bring hope and inspire many others around the world. Let's listen in.
Yes, let's listen in.
And you have been working for almost 2 decades on the fight for universal health coverage, on social protection, and the strong public services. And I would like to know, what does your experience tell us about the right to health and how this discussion and this work has changed over these years? And what would you say are the main threats facing healthcare system around the world now?
Well, those are big questions. Maybe I should start by explaining that I think all of my work for Oxfam and beyond on health has been driven by a very simple and core understanding that a universal, publicly financed and delivered healthcare service that is free at the point of need is not only the very best expression of our humanity, but it's also one of the most powerful and effective ways of fighting both health inequality and inequality writ large. So I'd just say that all my work over the years has been about pushing towards that goal, but also pushing back against ideology, policies and interests that move us further away from that goal. And my work has evolved to respond to the threats and opportunities along the way over those last couple of decades. In my early years at Oxfam, for example, I worked in support of lots of campaigns in global south countries to get rid of deadly user fees and to reverse spending cuts for healthcare that were imposed on countries as part of structural adjustment policies by the World Bank and the IMF. And as the World Bank and some of the rich country government donors developed a new fixation with imposing health insurance schemes onto countries, I responded by working with teams and coalitions to expose how regressive and unworkable many of these were in countries with large-scale poverty and informal economies. And a big part of our work, of course, has been about fighting the pharmaceutical monopolies that keep medicine prices high and locked out of reach for most of the world's people. And this included, of course, the incredibly important recent campaign for a people's vaccine during the COVID pandemic. But I think, the most important and consistent thread that has run through most of my work has been an ever-present concern about the rising power, influence and role of private commercial actors within global health itself and within domestic healthcare financing and provision. The neoliberal doctrine was first to shrink the size of the state in public services, and then next to use this growing, largely informal and unregulated private sector itself as justification to start publicly funding private commercial actors in place of government, whether that be via health insurance schemes or public-private partnerships. And my work has been to push back on that dominant narrative here and, using hard-hitting evidence, expose the harms of pursuing these types of approaches in practice. And I guess here, to answer the last part of your question, coming to what I think is one of the greatest threats we face now, and that is not just the privatization agenda, which, is ever present, but actually the growing role of hugely powerful private financial actors in health systems across the world. And here I'm talking about hedge funds, asset managers who are controlling trillions in assets across the globe. And by being allowed to play a much more direct role in global health funding schemes, whether that be for pandemic insurance or global vaccine purchases, or buying up private hospitals and care homes in countries, these actors are fundamentally transforming all elements of health and healthcare into potential financial assets, where the primary objective becomes not good quality, equitable, universal healthcare that delivers the right to health to everyone, but actually just getting as rich as possible, as quickly as possible. As one Kenyan doctor recently told me, private equity owning hospitals is about turning patients into ATM machines.
Thanks so much for that, Anna. We're also seeing similar problems in climate. So we're actually trying to adapt the kind of work that you have done on health to show that there will be ramifications if we take similar path in terms of climate action. The next question is for you, Dr. Aquina. You're currently working in South Africa's health department. Could you tell us a bit about yourself, your background, and what drew you into this work?
So thank you very much for that. My name is Aquina, as you have said, and I work for the Department of Health here in South Africa in the area of systemic policy reforms. I've been drawn to this work because of what I want to regard as a crisis of health in South Africa, but not just in South Africa. I think in Africa and also globally. I was compelled by the stark injustices in my country, where 16% of the population commands 60% of the specialist doctors and 80% or more of the financial resources in the country. This disparity is a direct form of structural violence, where access to dignity and life itself is determined by wealth, race, and history, and not your health needs. My purpose, therefore, when I wake up every day, is to dismantle the residual architecture of this health apartheid and to affirm health as a fundamental human right and not a market commodity. Working in the health department has meant standing on the front line of a political economic battle. My work hasn't just been about drafting policies. It has also been about challenging entrenched market failures and power dynamics. And in this role, we aim to shift the equilibrium of power back to the state and to the people by decommodifying health. And this we are doing by driving the implementation of national health insurance, which is a necessary structural mechanism that we have adopted here in South Africa to pool resources and eliminate the fragmented two-tiered healthcare system. And we have developed legal frameworks to ensure that the national interest outweighs shareholder interest in this regard.
Dr. Aquina, it's interesting how you raise the point of inequality in South Africa, both in general, but also in the access of the right to health and health systems. And this year, actually last week, South Africa was hosting the G20 meeting. And one of the main topics that they had was a fight against inequality. And also during these meetings, you had a high-level meeting on the risks of privatization in healthcare. How do these two things integrate each other, and why did you have such a focus on this, on inequality and the privatization of healthcare?
Our theme for our G20 presidency was on equality, solidarity, and sustainability. We correctly identified that inequality is no longer just a social grievance, but a structural cap on global economic growth. And we wanted to talk to the 20 most powerful countries on the world around the economics of inequality and injustices and lack of solidarity. We also wanted to highlight some of the findings of the Extraordinary Committee on Global Inequality, which had declared inequality an emergency because we had hit the ceiling, what is known as secular stagnation. When wealth concentrates too heavily at the top, global demand is suppressed. The wealthy save or speculate. They do not consume enough to drive the real economy. Furthermore, inequality fuels political polarization and civil unrest, creating a climate of instability that markets would fundamentally reject. Therefore, the South African leadership recognized that we cannot have economic stability without social stability. We cannot have social stability when essential human needs like healthcare are turned into speculative financial assets. The danger facing our healthcare system is not merely private ownership, but the financialization of that ownership. And this, in our understanding, occurs when healthcare facilities, healthcare financing itself is treated as tradable assets by a private equity and institutional investors, prioritizing their short-term yield over long-term health outcomes of our population. Therefore, in summary, I want to say that South Africa's health system has created a formidable opponent to health equity. The private sector is not just a collection of competing businesses. It is globally interconnected, financially powerful machine whose primary purpose being to deliver shareholder returns and is fundamentally opposed to the state's constitutional mandate of delivering universal human rights. And therefore, what drives us every day is to try and face this monster head on.
Thank you so much, Dr. Aquina. Every time I learn about these issues, especially, the financialization of public goods such as health, which affects all of us, I find it both frightening and enraging. And, I'm always asking myself, why has the public not woken up and fighting back? But as you say, this is by design. Powerful and coordinated elite is fighting relentlessly for their own interests. So, Anna, coming to you, you were right there at the G20 meeting, and you've always been a powerful voice for strong public health care. So this idea that private finance is, the silver bullet for funding shortfalls, the answer to achieving healthcare for all, it's really convincing some decision makers, no? So how do we effectively tackle this pernicious idea? What are the key counter arguments we need to make?
Maybe I should just start by just saying a massive thank you to Dr. Aquina and the South African government for being so willing to provide a platform for this topic at the G20 this year, because honestly, this was an incredibly unique opportunity to discuss and present the evidence that we've been talking about today at that level, or indeed, I have to say, at any level, because so much of the narrative, so much of the debate within global health is also captured by these vested interests, which means we never hear this counter evidence, this counter narrative, the reality of the impact of these financing models being deployed. And I think there's a number of things we've got to do to challenge this. And I think first we need to shine a light on the reality of what it means to crowd in private finance. The very simple fact that private finance doesn't come for free. It wants to make high returns, and, the pressure is on to make higher and higher returns every day. And invariably, this private finance ultimately costs far more than funding from the public purse, and that investors and the wider financial industry, including brokers, lawyers, accountants, and management consultants, are consistently winning at the expense of governments, patients, health workers, and ordinary people. And I think it's also really important that we expose how this is contributing to that massive transfer of wealth from the public to the private sector that we've seen over the last few decades, and the extreme concentration of wealth in the hands of very few people, mostly white men. And also how that concentration of wealth and power is in turn corrupting healthcare policy making and, of course, wider democracy. I mean, most importantly, in my opinion, is that we must do more to expose the human consequences of this type of investing. And my own research showed how private hospitals funded by private equity in partnership with development funding are implicated in wide-ranging human rights abuses, including countless patients detained like prisoners in hospitals until bills were paid. Emergency care denied to so many women and children with life-threatening injuries because they can't afford to pay up front. And, we know that the findings from our research, it's not isolated. This is a systemic problem. Multiple investigations have been carried out since we published our research by the likes of Bloomberg and the ICIJ, and they've revealed yet more human rights abuses, more patient detentions, patients' lives being put at risk because profits are being prioritized.
Absolutely, Anna. We do need to expose what's happening and what's behind this privatization of the healthcare systems around the world and who are behind it. So thank you for doing that, both of you. And Dr. Aquina, while I was listening to you speak about the threats that the health system in South Africa is facing, I could hear your warrior voice, but also I could hear from your voice that you have a vision, that you can see alternatives for this. So what are the alternatives that you see for the South African healthcare systems to face these threats of privatization? And also, what do you think that other countries could learn from South Africa in this, and that South Africa could learn from others?
South Africa, unfortunately, serves as a crucial case study in the perils of financialization, the power of fragmentation that exists in South Africa. We believe that the world can learn that extreme fragmented two-tiered systems where high private spending fails to achieve adequate public outcomes is something that we must not repeat or emulate anywhere else in the world. The alternative to a financialized healthcare system is one where the state deliberately decommodifies health and enforces a model that is based on equity and solidarity. So one of the alternatives would be to move to a single-payer unified governance model of healthcare, which is the primary and most effective alternative. And here we are talking about systems such as what we are proposing here in South Africa in our national health insurance, or systems such as those in Canada, Indonesia, or even Thailand's, even though they still have fragmentation. But I think, the financialization is not as stuck. And maybe to some extent, I know that the UK's NHS is also going through its own problems, but in one way or the other, it used to be a shining example at some stage in the past. A single payer system immediately addresses the financialization threat by making the state the dominant buyer of health services, a monopsony. And this will eliminate the incentives for private actors to inflate prices or to use stock exchanges as the platform for creating shareholder value. And this will effectively remove the lucrative arbitrage opportunities that feed financialized capital. The other activity that is required for a single payer model, it's what I call a social justice outcome that enforces risk pooling, single pool, bigger is better, and the healthy subsidize the sick, and the wealthy subsidize the poor, and the young subsidize those that are older, making healthcare an equalizing factor in society rather than a driver of inequality. We have learned from countries that have successfully overcome initial political resistance and managed transition that political will is very, very important. And this was seen in Canada and also in UK post Second World War. And the key lessons are that the transition to a single payer model requires unwavering political commitment. Financialization litmus test is on our NHI legal battle. Other developing countries can learn from South African civil society and the state that are navigating the legal and political attacks financed by global and domestic capital, attempting to preserve their market rents. We are pioneering the legal defense of the public good against sophisticated private interests.
Thank you so much, Dr. Aquina. Clear and concrete recommendations, and it's based on lessons learned from other countries, as you said. I hope we can all push forward to achieve these goals and, ensure universal health for all. But back to you, Anna. Looking ahead, despite, this challenging landscape, what examples or movements in the past few years give you real hope that we can push back against privatization and financialization? Are there specific countries you see really leading the way?
Just listening to Dr. Aquina, I mean, it's so inspirational how the South African government, the Department of Health particularly, are attempting to safeguard health as a public good, to push back against these incredibly powerful global actors. And it really is, I've said it already, but pretty unique to see a government willing to talk about these issues and willing to talk about this imbalance of power that they're facing and how this is playing out in the courts in South Africa as well. I mean, I think anyone interested in this topic needs to look at South Africa and heed Dr. Aquina's warning, but also take inspiration from the way that they are fighting hard each day to try and implement a more universal and equitable healthcare system. And I would echo the point that political will is the most important ingredient in this, and really hope that South African politicians can push through and achieve the goal of a universal, equitable, single payer system. I also think, it's often referred to as an inspiring example, but Thailand really does provide us with another kind of model to look up to, a government that really has, also, in the midst of a financial crisis, made a political decision to implement a universal public healthcare system. And it really scores highly on achieving equity, good quality, universal access, driven through public financing and public provision, but that there is a private sector that exists and serves a minority of the population in Thailand. But the point is that the government really keeps a tight rein on that sector. It's highly regulated, and it's a model that is working. I know also that it is a model facing challenges from those powerful private financial actors, but so far has been able to resist. Another really good example of how a system can be regulated for the benefit of the public good is Japan's healthcare system as well. And this might be strange to say, but I also take some hope the debate that's going on in the US right now amongst some politicians, because we know that if there's ever a warning against privatizing and commercializing your healthcare system, it is the US. But following a number of quite high profile bankruptcies of large private sector hospital corporations in US, it really has stimulated a political debate on the need to start bringing in much stronger regulation and more transparency around the role of these private financial actors within the healthcare system itself. And, there is bipartisan concern about this. And if that's happening in the country with the most commercialized healthcare system in the world, that's got to give us hope that those politicians in other countries could start to take note of these problems as well. So I think that's a really interesting debate to watch, and to look at some of the legislation that some of the states have implemented to try and curtail the power of these financial actors as well. I think also what motivates me and keeps me hopeful is that I see a growing number of both academics, activists and organisations who are starting to work to expose these issues in healthcare, to expose the conflicts of interest, to expose the human consequences and the financial consequences for governments and patients of these models. I'd love to highlight the work of a few organisations for listeners who are interested in this topic to look into. And the first is the Private Sector Equity Project in the US. They're doing brilliant work investigating, exposing, but also working with legislators to improve regulation. And in the UK, there is this fantastic organisation called the Centre for Health and the Public Interest, which is likewise doing brilliant investigations showing the harm being caused, the leakage of the National Health Service funding in the form of profits to these private equity-owned healthcare providers. And in South Africa, the organisation Open Secrets, who have recently done a brilliant expose of who really owns the health sector in South Africa, mapping out much and in more detail of what Dr. Aquina has been able to share with us today as well. So I think the appetite, the enthusiasm, the unwavering commitment of people like Dr. Aquina gives me hope every day that we can come together and we can fight these very powerful actors and achieve those goals of universal, equitable access of healthcare for everybody.
Thank you so much, Anna. Thank you so much, Dr. Aquina, for such an incredible interview. I found it truly, eye-opening, enlightening, but also enraging in its exposure of, the injustices within the health system and the reality that we're fighting against powerful global interests. But despite these challenges, you're giving us hope that there's an alternative vision and a way forward to ensure everyone in the world has access to health and dignity. So thank you so much.
Thank you so much.
Thank you.
What a powerful episode, Grazie. I really loved it. What did you think?
Well, I think it was really inspiring to hear these two women who are so strong, who are so courageous, and who are every day fighting against the corporate power that is trying to reduce the right to health.
Agreed. Really inspiring. And I truly believe, we all need to stand behind them in this fight. And Grazie, I was thinking, to be honest, throughout the interview and also now reflecting, during COVID, I really thought the world would change, that humanity would come together. You remember, whichever part of the world you were at, the dystopian time we had, how we were all scared, but also felt united with our experience. There wasn't a part of the world that was not impacted. Then we were told that if a vaccine was developed, it would be shared with the whole wide world. And then miraculously, in less than a year, the vaccine was developed. But when it came to distribution, it was done in the most unjust way. I remember getting vaccinated in London and hoping and praying that, my elderly parents and my grandmother in Ethiopia would get the same chance. But it didn't happen until much later for them. And even then it happened due to the Ethiopian government's, managing to secure a few doses of vaccine through Gavi. So pharmaceutical companies made billions. They were charging developing countries even more than they were charging richer countries. So where is the justice and fairness in that? Or even where is our humanity? All I'm trying to say, Grazie, is the COVID experience really made me realize how much we need to mobilize and fight for our rights. And listening to Anna and Dr. Aquina today also made me realize how incredible folks like them are fighting for our rights. But I think it's important for all of us to realize that access to public health is our right and that we should collectively come together, and fight vested power and interest to ensure that our rights and the rights of everyone around the world are protected.
Absolutely. What a powerful way to end. We really need to make sure that the right to health is the minimum of dignity that everyone deserves as a human being. So please help us spread the word, subscribe, share it, and enjoy the conversation.
Look out for our episodes with Thomas Piketty on the call for a new intergovernmental panel on inequality.
And don't forget to sign up for our newsletter at equals.inc.
Thank you so much for listening. Until next time.
Thank you. Bye.